Welcome back to The Blend. We've been talking a lot about Medicare open enrollment lately, but it's not just Medicare. Nevada HealthLink Exchange has begun enrolling Nevadans to get health insurance that's right for you. And here to explain is Janelle Davis with the Silver State Health Insurance Exchange. Great having you.
Happy to be here.
Let's talk about this. There's different open enrollment, different dates. Open enrollment began on the 1st. What do people need to know?
Yeah, the biggest change is that our open enrollment period has been shortened. So Nevadans only have until December 15th to complete the process of enrolling in a health plan.
That's 45 days. What was it before?
It was 90 days before.
So they cut it in half.
They cut it directly in half. Yep.
Excellent. So who is eligible to enroll in Nevada HealthLink, and what is Nevada Health?
So Nevada HealthLink is the online marketplace for eligible Nevadans who currently don't have health insurance through their employer to get enrolled on a health insurance plan. Now, these are also plans that have federal subsidy assistance available, and about over 80% of our enrollees we are finding are actually able to access that federal financial assistance to help offset their monthly premium.
And it's not all just for low-income people. Sometimes it's people that are they're self-employed. They might make a lot of money, but they want to be able to get health insurance through a network plan like Nevada.
Yes, a self-employed is a good example. Really, these are plans that are open to any demographic, any age, and really just people who are underinsured or not insured at all. Because despite what we hear, the ACA is still the law of the land, and that tax penalty still exists also.
Absolutely. Some states don't have a state exchange.
Correct.
And some do. Nevada's one of the fortunate ones that do.
Yes.
The ones that do typically have not seen health insurance costs rise as much as the ones that don't. Luckily, Nevada's among those that have had a relatively low increase in health care costs.
Yeah, you're right. I mean, obviously premiums increase. Unfortunately, it's just how it goes. It's a national medical trend. It happens every year. But what we're finding is that if your premium increases, so does that federal financial assistance. So your subsidy also goes up. So we're finding that the majority of our enrollees there's still affordable plans available, and that they're able to access that financial assistance.
And you can go directly to Nevada HealthLink to get it. That's the benefit of having a local exchange as well, versus going through the federal website.
Correct. So Nevada is actually a unique hybrid system.
Oh, okay.
So we have our own state-based marketplace. We have our own marketing outreach team. We're all based here in Nevada. However, if you go through, you can start on NevadaHealthLink.com, take that pre-screener series of questions, because these are all income-based plans. And then from there, you'll either go to healthcare.gov or to Medicaid, depending on your income and what you're eligible for.
Gotcha.
So we do operate using the federal platform, but it's strictly just for technology purposes.
Gotcha.
Yep.
Obviously, a lot of people, they hear healthcare. We're not at 100% insured in the state, so there's obviously people who are throwing their hands up saying it's too expensive.
Yes.
But you were talking about these subsidies. I mean, how deep do these subsidies go?
So it really just depends on your own unique situation. Again, these are income-based plans, but depending on what your income is, that's the federal assistance and subsidy, whether it's cost-sharing reductions or advanced premium tax credits. They can go pretty deep. For example, you could see without a subsidy about $700, and that down to maybe $200.
Wow.
So it's very effective, and the biggest thing is that Nevada HealthLink is here to help. Insurance is confusing. We have partnered with community stakeholders throughout the state, and we're here to help you enroll through that process.
Insurance is confusing.
Just a little bit.
Nobody is shocked by that sentence at all. Let's talk about the elephant in the room, obviously, the ACA. There's been a lot of talk about repeal and replace. It hasn't happened yet. I know there's been several opportunities under a Democrat president, a Republican president, Republican Congress. Where are we right now? This is still the law of the land. This should not be an issue for people getting insured in 2018.
That's correct. It's a little bit of a lull right now, I would say. And so open enrollment is underway. It ends December 15th. And for those individuals who are thinking, well, I don't really want to, get insurance, they will be penalized through the tax penalty through the IRS. And hopefully, we continue to see improvements, and, maybe this isn't the answer, and, we can't tell, but as of right now, we're here to help, and it's just so important to be covered for yourself and your family.
It certainly is, and it's great having you here once again, and we're going to get people insured. December 15th, you know the deadline.
Yep, that's the day, at midnight.
On the clock. So get started. Your employer doesn't offer health insurance, huh? You're self-employed maybe. Maybe you don't qualify for Medicare or Medicaid. You can enroll through Nevada HealthLink. It's also available to children.